Thousands of doctors and nurses in Kenya are yet to be vaccinated. They are just part of millions who are victims of one of the inequalities exposed by the pandemic. Across the global south, health workers are being killed by a virus from which their counterparts in rich countries are largely protected. But this is just the most visible cost of a rich-poor divide that has deepened in the second year of the pandemic. Of the vaccine doses distributed globally, roughly 3/4 have gone to only 10 countries. At least 30 countries in the world are yet to inject a single person with a COVID vaccine. 30 countries. Scientists have long warned that such unfair treatment will make sure that the greatest human costs will be mostly borne by poorer nations. Already, unvaccinated doctors and nurses have died in countries like Kenya, Mozambique, Nigeria and Zimbabwe, depleting health systems that cannot afford to lose any more healthcare workers. The situation in Africa is especially bad. The continent has 17% of the world's population, but so far it has administered roughly 2% of the vaccine doses given globally. In a worrying sign of how uneven the distribution is, even Kenya, one of Africa's wealthier countries, is faring badly. The first million doses arrived only earlier this month, and only a quarter of what had been promised. India stepped in with a small but welcome batch of 100,000 doses, but Kenya has no idea when the next batch of vaccines will arrive. Kenya is expecting to inoculate only 30% of its people, or about 16 million out of almost 50 million people, by the middle of 2023. When the rest of the population will get their shots is anybody's guess. For wealthy countries, Kenya's timeline is unthinkable. President Joe Biden has promised vaccines for all adults in the US by the end of May this year. Israel has already vaccinated 60% of its people, and Britain nearly 41%. World Health Organization Director General Tedros said this week that vaccine inequity is becoming grotesque every day.
In January, I said that the world was on the brink of a catastrophic moral failure unless urgent steps were taken to ensure equitable distribution of vaccines. We have the means to avert this failure, but it's shocking how little has been done to avert it. The gap between the number of vaccines administered in rich countries and the number of vaccines administered through COVAX is growing every single day and becoming more grotesque every day.
Vaccine delays are also expected to cripple the economy. Researchers say that poorer countries shut out from vaccines this year, the global economy could suffer losses exceeding $9 trillion, nearly half of which would fall on countries like Britain, US and Canada.
There, I got one. I mean, they're like in shadow.
WION is now available in your country. Download the app now and get all the news on the move.